I'm Mila Brujic. I'm a partner of a four-location practice in Northwest Ohio, Premier Vision Group. And here we're always challenging ourselves, focusing on really where the gaps are in patient care and attempting to fill those gaps. One of the biggest challenges when it comes to managing a practice is really understanding the profitability structure. And really, the way that I view this whole kind of structure of optometry as a business owner is real simple. And I realized this several years ago. We realized that profit is nothing more than a byproduct of really filling the gaps where we're seeing it in patient care. Fortunately, with optometry's expanded scope, we've actually had the ability to offer expanded services. So as inflation, as all these other things start to challenge us, and that's probably been the biggest single challenge in 2022. The second is the kind of the post COVID meltdown, meaning not that everybody's financial picture is changing significantly, but you're starting to hear more about concerns of a looming recession. And we're even seeing that in terms of the way that patients are communicating to us. They're seeking and searching more value, much more so than they did at the end of 2020 and 2021, where everybody kind of did everything we recommended for them. Now they're looking for a little bit more justification behind this. So those were two major, major challenges in 2022. So the question then becomes, so what do we do to kind of thwart or kind of negate some of these challenges? And one of the things we did was we kept true to our mission. Okay, what do we have? What can we do for patients? And where are we providing or not necessarily providing opportunities for patients that we can be? And in my mind, that lies in the specialties within optometry. And there are several. One that I've invested heavily in is specialty lenses. There's keratoconic patients. There are epithelial basement membrane dystrophy patients. There is the irregular corneas from post-herpetic scars. There are post-LASIK ectasias. There are all these conditions that we can manage much more effectively with specialty lenses. And just to give you a perfect example, from 2021 to 2022, we increased our specialty lens business by 28%. So what that means is we were just caring for more patients. There's a second kind of bucket that exists there, and that's the ocular surface just in general, specifically the dry eye world. So when we compare our 2021 numbers and the procedures that we did to help dry eye patients in 2021, and we compare that to 2022, we actually increased the number of procedures that we actually did for these patients by 33%. Certainly some of those are repeat patients that need retreated, but there are also other individuals that are either being referred into our office or also hearing about our services. Now, that's just a slice of the pie that we're actually seeing here, because ultimately there's other things that come into this equation. For example, medical diagnostics. Are you caring for the full patient? And one of the metrics that we utilize to see that and look at that is our utilization of OCT, and how frequently or infrequently we're utilizing those tests. And we see 2022 versus 2021, we've increased the utilization of the OCT scans by 9%. So everybody in the practice is taking more full scope care from patients or for patients. Ultimately, all of this leads into what I consider to be one of the kind of the key metrics in optometry. And there are a lot, and we can get lost in a lot of the minutia, but I like to look at top line number. And then I like to break it down just one level and like to say, okay, when we take the number of refractions that we've performed in a given period of time, and we look at the total dollars that we've generated in that time period and divide it by the number of refractions, what's that total? Because the more comprehensive care that we provide these patients, typically the higher that number will be, because profit is nothing more, again, than a byproduct of full scope care. And what we can see is that in that time period, 2022, or from 2021 to 2022, we actually increased that number by 9%. And what's interesting is in a few of our locations, we've actually done a little bit less refractions in a given time period, and we're actually more profitable. So again, being hyper cognizant of the full scope of care that optometry provides, I think is key and king in really understanding the business model and really not only just surviving, but thriving in this new era of eye care. Yep. So there's a few other things. When you look at top line number, we're up. We're up about 9% over 2021, and the year's not done yet. So we're looking to have a pretty good year, in particular when you're talking about for what I would consider established practices. There are some moving dynamics that exist there. But what is interesting as well too is when you look at the dollars generated per refraction, even per location, there's differences there. And we're looking at that right now, trying to figure out why is it higher in some locations, or why is that needle moved up in certain locations and not others? So these are interesting metrics that we're looking at right now. And some of them we don't have the full answers to. So there's really things that we need to be thinking about in optometry when we're thinking about how do we take a practice and grow it. And really my philosophy is very simple. Let's take a look at the gaps in care and let's see how we can fill some of those gaps. And if we provide care in that general vicinity very proficiently, we increase the number of encounters that we do for that. A passion that I have is specialty care, and there are several areas of specialty care. So we've invested heavily pre-COVID into understanding specialty lenses and the ocular surface. So when COVID hit, we were already streamlined and ready to go in these specialty services. Sometimes it gets difficult, and when I talk to some practitioners, they say, I feel like I'm in the rat wheel. I feel like I'm doing the exact same thing, but can never get ahead because I'm always caught up in the exams. And that gives you the ability to pay less attention to building subspecialties in your practice. I think 2023 and looking ahead into 2023 is continuing to specialize in optometry and expanding some of those specialties with the hopeful increased scope that optometry will have, and also doing a deeper dive into the specialties. So again, we're hoping to continue to increase our specialty lens business. We're hoping to continue to increase the specialty dry eye services as well too. Now saying all of that, we haven't really talked about the optical, which is a significant portion of the business. We continue to do what we're supposed to be doing in that realm as well too, and we rely and lean heavily on our opticians and our optical staff in order to make those things happen. So again, finding out where the gaps are, leveraging our knowledge within those gaps, and making sure that the patients that we care for, we do it really well in those specialties that we want to pay attention to, and continuing to increase the percentage of those specialties that we provide. That's really the goal for 2023. So just a few pieces of advice as we kind of end off 2022 and we're going into 2023. I think every year, regardless of whether or not this is real or kind of man-made, it gives us an opportunity to take a step back and say, all right, let's kind of recalibrate things. And what I found is slow, consistent changes always beat out massive changes, meaning I've talked to clinicians who say, I want to do dry eye, so I'm going to get this piece of equipment. Well, the piece of equipment doesn't make somebody do dry eye. There's a philosophical shift or change that makes somebody interested in dry eye. I'll give you a perfect example of what I mean. I started managing dry eye in 2005, and the reason why was out of necessity to safeguard losses in my optical. And I have to share with you this perfect example. In 2005, I had a patient. She was a 42-year-old myope. Her chief complaint was, I can't see up close through my glasses. She was a -1 in the distance. I refracted her at a +1 ad, and we got her a pair of progressive edition lenses. A month later, she was back on my schedule, and she came in saying, I can't see out of my new glasses. Well, I thought it was a progressive non-adapt. And we have a policy in our office. If you don't do well with your glasses and the optician can't work with you to figure out what's happening, we're going to see you back for that visit. Saw the patient back. She was describing it, and she read the 20/20 line on the eye chart, but she read it with fluctuation and blinking and needing to clear it. Well, I assessed her eyes with fluorescein at the time, and it was clear she had frank dry eye that I missed at the first visit. I realized at that point that I needed to understand and take dry eye more seriously, and I needed to more actively diagnose and treat it to safeguard what happened in the optical, which is she got glasses from our office and she thought that she couldn't see appropriately out of her glasses because of something that I measured in the prescription or something that our opticians did incorrectly, when in actuality, I missed a diagnosis. I was lucky she came back. I was lucky she came back to the office. I was lucky she brought all of this up to me. But philosophically, it shifted the way that I looked at the ocular surface. That point moving forward, every single patient I examined had fluorescein placed on their eyes. And I identified these individuals before they got glasses in our office. Why do I share all of this? I share all of this because me getting into dry eye management had nothing to do with me buying a unit or a system or a diagnostic or a therapeutic procedure. It was me looking at my patient base and saying, I need to better identify this. Step one. Step two is, now let's put together some form of regimented treatment or some type of care regimen for patients when I'm identifying these individuals. And that evolves. And as that evolves, then you start seeing where procedures or certain things can fit into the mix. So my kind of guidance to any clinician is take a look, take a step back at your practice and make kind of 3 goals for yourself, 3 things that are modifiable behavioral changes, and say, how could I do what I'm doing right now and just shift it and make it just a little bit different? Because here's where the benefit would be to patient care. Because ultimately, at the end of the day, I don't care what we're talking about, it's actually going to lead into profitability. Again, I've seen the direct link. You take better care of patients by modifying certain things in the way that we do it, and that will lead to profitability. But don't go overboard with those goals. Make them easy, make them identifiable, make them measurable, and make them so that they're crystal clear. We're in the season of New Year's resolutions right now. One of the worst New Year's resolutions you can make is, I want to lose weight. One of the best New Year's resolutions you can make is, I want to lose 5 pounds. Because if you just want to lose weight, you're going to lose weight, but are you successful or are you unsuccessful? And how do you know if you're successful? If you tell yourself, I want to lose 5 pounds, you'll know if you're successful or unsuccessful, because that's a very measurable thing. And whenever you set that goal for yourself in your practice, think about it and do the exact same thing starting in 2023. Make it so that when you look back in 1, 3, 6 months, you can say, yep, I've made it, I've kept that goal, or I fell off the rails. And that's okay if you do fall off the rails. I've made goals that I've fallen off the rails on. And sometimes I say, yeah, I really wasn't as passionate as I thought I was about that goal. Other times I fell off the train. I said, you know what? I really need to get back on the train. We really need to do this because this is what's in the patient's best interest.